Understanding HMPV, a common respiratory virus. Human metapneumovirus, or HMPV, is a common respiratory virus that affects the respiratory tract. It was first discovered in 2001 by Dutch scientists, but has likely been circulating among humans for much longer, possibly centuries. HMPV is a global virus infecting people of all ages, races, and backgrounds, making it a significant public health concern. Most people experience mild, cold-like symptoms when infected with HMPV, which can be easily mistaken for other common respiratory illnesses. These symptoms can include a runny nose, cough, sore throat, and fever, often resembling a common cold or flu. However, HMPV can cause more severe illness in certain individuals, leading to significant health complications. Infants, young children, older adults, and people with weakened immune systems are at higher risk of complications, which can be life-threatening. In severe cases, HMPV can lead to bronchiolitis, pneumonia, or respiratory failure, requiring intensive medical care. There is currently no vaccine or specific antiviral treatment for HMPV, making prevention and early detection crucial. Treatment primarily focuses on managing symptoms and providing supportive care such as hydration, rest, and, in severe cases, hospitalization. The current situation in China. A seasonal surge. China, like many parts of the world, is currently experiencing an increase in HMPV cases. This surge is part of a broader trend of rising respiratory illnesses during the winter months. Several factors contribute to this seasonal pattern. Colder temperatures drive people indoors, increasing close contact and facilitating virus transmission. Additionally, the human immune system tends to be weaker during winter. China's recent relaxation of its zero-COVID policy may also be playing a role in the current surge. Lockdowns, unlikely lessons learned, and alternative approaches. Given the increase in HMPV cases, some may wonder if China is considering another round of strict lockdowns. However, such measures are highly unlikely. China has learned valuable lessons from its experience with zero-COVID. The social, economic, and psychological costs of prolonged lockdowns are now well understood. Instead of lockdowns, China is likely to focus on alternative strategies to manage the HMPV surge. These may include promoting vaccination against other respiratory viruses like influenza, increasing public awareness about preventive measures, and ensuring healthcare facilities are prepared for a potential influx of patients. Section 4. Protecting yourself. Practical steps for respiratory health. While the risk of severe HMPV infection is generally low, there are several steps individuals can take to protect themselves and their families. These steps are simple yet highly effective in reducing the risk of infection. Frequent hand washing with soap and water is crucial for removing viruses from the hands. It's recommended to wash hands for at least 20 seconds, making sure to scrub all parts of the hands, including between the fingers and under the nails. If soap and water are unavailable, alcohol-based hand sanitizers are an effective alternative. Ensure the sanitizer contains at least 60% alcohol for it to be effective in killing germs. Covering coughs and sneezes with a tissue or elbow helps prevent the spread of respiratory droplets containing the virus. This simple action can significantly reduce the transmission of infections in public spaces. Used tissues should be disposed of properly. Always throw them into a trash can immediately after use to prevent contamination of surfaces and hands. Avoiding close contact with sick individuals is another important preventive measure. Maintaining a safe distance can help minimize the risk of catching or spreading the virus. If you're feeling unwell, it's best to stay home to avoid infecting others. Resting at home not only helps in your recovery, but also protects the community by reducing the spread of the virus. Section 5. Staying informed, staying calm, navigating public health concerns. In the digital age, misinformation about infectious diseases can spread rapidly, leading to unnecessary fear and anxiety. It is crucial to stay informed about HMPV and other public health concerns from reliable sources. Trusted organizations like the World Health Organization, or WHO, and national health authorities provide accurate and up-to-date information on infectious diseases. Relying on these sources can help individuals make informed decisions about their health. It is important to remember that the respiratory viruses are a common part of life. Section 6. Conclusion. A balanced perspective on HMPV in China. The recent surge in HMPV cases in China is a reminder that respiratory viruses remain a persistent public health concern. This virus, like many others, can spread rapidly in densely populated areas, making it crucial for public health officials to stay vigilant. While the situation warrants attention, it is essential to maintain a balanced perspective. Overreacting can cause unnecessary panic, while underestimating the threat can lead to complacency. HMPV is a common virus that typically causes mild illness. Symptoms often resemble those of a common cold, including runny nose, cough, and fever. Severe cases are relatively rare, primarily affecting vulnerable populations. These include the elderly, young children, and individuals with compromised immune systems. China is unlikely to resort to large-scale lockdowns, opting instead for targeted measures to manage the surge. These measures may include localized quarantines and increased testing in affected areas. By practicing good hygiene, staying informed, and seeking medical attention when necessary, individuals can effectively protect themselves and those around them. Simple actions like washing hands regularly and wearing masks in crowded places can make a significant difference. Please like, share, comment, and subscribe to our channel for more updates.